Did you know that huge, rapid weight loss, whether from bariatric surgery, weight loss meds, or a hybrid of the two, can result in a 20 to 25% loss of muscle mass? Did you catch that? 20 to 25% loss of muscle mass. Yes, they're all the rage right now. Weight loss medications, also known as obesity meds and GLP-1 medications. As medical professionals, we tend to use the term obesity medication. Why? Because obesity truly is a disease, and these meds treat more than just weight, with positive effects on diabetes, blood fats, blood pressure, food noise, cravings, and more. Studies are finding that the use of these medications, when appropriate, in combination with bariatric surgery, can result in even more long-term weight loss success. But what about this loss of your muscle mass along with the weight? How does the loss of muscle mass affect your success long-term and even your health? What do you need to know right now to preserve or increase your muscle mass so you enjoy great success? Well, don't you go anywhere, because bariatric sports dietitian Kim Tirapelli joins me to answer these questions and more. You don't want to miss this discussion.
They're back. Calcium Dark Chocolate Bars, a ProCare Health customer favorite. Now available online at procarenow.com. Creamy chocolate plus calcium and vitamin D. You'll love them too. Use code SUSAN10 to save 10%.
I'm bariatric dietitian Dr. Susan Mitchell, ex-radio dietitian turned podcaster. You're listening to the Bariatric Surgery Success podcast. Are you frustrated with all the confusion when it comes to nutrition? I get it. It's hard to decipher sound science from pseudoscience. It's enough to make you give up and say, I don't know what to do. Well, I do. I know what to do. It matters where you get your nutrition information. When it comes to your bariatric surgery, nutrition is specific. So let's cut through the nonsense. Let's get what you need to know now. I created the Bariatric Surgery Success podcast to give you accurate nutrition information that you can count on. It's simple, it's actionable, step-by-step strategies that work. I'm here to help you feel great every day and get out there, do the things you want to do. So you're in the right place, and let's get started. I'm a big fan of sheet pan dinners. I make them often using salmon, shrimp, or chicken. This past weekend, I did one with chicken tenderloins, carrots, and asparagus. You can try some easy sheet pan dinners if you want. I'll put the link for the freebie in the show notes, or you can go right to breakingdownnutrition.com/sheet pan dinners. Joining me in the studio is bariatric sports dietitian Kim Tirapelli. Let me tell you what I love about Kim. She took her passions for sports nutrition and bariatric nutrition and combined them together. She works with active bariatric individuals who have fitness goals but don't know how to adjust their nutrition to match their needs. Kim knows how. As a certified specialist in sports dietetics, Kim works one-on-one with her clients to optimize nutrition to meet exercise goals after weight loss surgery. And you can also listen to Kim on her podcast, the Active Bariatric Nutrition Podcast. And don't forget, find all the links to Kim's contact information and social platforms in the show notes. Well, hey, Kim, good to have you back.
Thank you so much for having me. I'm so happy to be here. It's such a great discussion topic.
Yeah. And before we jump into our muscle mass discussion, just a little reminder about GLP-1. If you're listening and you're thinking, now, what is that again? Well, GLP-1 is a hormone that your small intestine makes, and it affects appetite, how we break down food, and use insulin. As a medication, GLP-1 is not a fat burner, but works on receptors in the brain. These medications are broken down more slowly, having a positive effect on cravings, food noise, meaning your constant thoughts about food, and on hunger. When you feel more full, you eat less. So think of it this way. These medications work in the brain while surgery works in the belly. So Kim, with a 20 to 25% potential loss of muscle mass with bariatric surgery and obesity meds, share what you focus on with nutrition and exercise to help retain and rebuild this muscle mass. I want to start with the big picture first of what you look at first when someone comes in, and then let's get really specific.
Sure. Yeah. When someone that I'm working with is going to start these medications, or maybe they've already been on them and they come to me because maybe they are seeing some muscle loss during this, rapid weight loss phase. The first thing I'm looking at is overall protein intake, their total overall just caloric intake in a day, but really specifically protein intake. And the reason that's important is because when we're in a caloric deficit, when we're taking in less calories than our body needs, right, during rapid weight loss, which these medications can suppress appetite, like you mentioned. And of course, having had bariatric surgery, our overall intake's already reduced. It's really important that we look at how much protein we're getting in a day to offset muscle protein breakdown. And that happens when we are in a low caloric environment. So to preserve muscle when we are in a low caloric environment, you want to make sure you're taking in adequate protein in a day. And then in addition to that, we look at resistance training. Now, some research out there has suggested in terms of how much protein to be taking in a day, at least 1.2 gram per kilogram. And that's about 0.5 gram per pound. So if you just took, half of your weight, that would be about the amount of protein in a day to be aiming for when you're on these medications to help maintain and or preserve or maybe even possibly build some muscle while we're also doing that resistance training.
So say that one more time in case that slipped by people. They're thinking, oh, wait a minute, I don't understand this. I'm confused about what you just said. Make that easy for me again when you said half the weight, because I think that's a great, easy way to do it.
So for example, if you're 150 pounds, if you're on a medication like this, you'd be aiming for at least 75 grams of protein in a day. Okay. Or if you're 200 pounds, you'd be aiming for about 100 grams of protein in a day while you're on these medications or in a rapid weight loss phase.
So Kim, when people come into you and they say, I think I'm losing muscle mass, what do they tell you that they notice? I think some people might be going, well, how do I know I'm losing muscle mass? Will it show? Will my muscles look smaller? Will I feel weak and tired? Will it be hard for me to pick up things? What do you say? What's the most common complaint you hear when someone comes in and says, I think I'm losing my muscle?
Yeah, I generally just hear from folks that, they feel less strong. So when they're doing things that maybe they were able to do before, they just don't feel like they have that power output that they had. Some will say too that they feel like they're having more loose skin, like they just don't have any definition as they're losing weight. And so they just can see it in the mirror that it looks like I just don't feel like I'm sustaining my muscle that I had before.
And what they don't understand or know potentially is that loss of muscle is also affecting how many calories they burn. So what I love is that you made it very easy by saying, just take your weight, divide that by 2, and that's going to be about how much protein that you need right now. So take that to the next step. And let's talk about, okay, let's say that you've decided you need 100 grams of protein a day. Are you specific then? Do you want people to eat that in meal balance, so much at a meal and in a certain timing? Let's talk about meal balance and timing.
Yeah. So when I work with folks, especially on this, I have like a pyramid, and the bottom of the pyramid is making sure we're getting in the right amount of protein in a day. Total protein in a day is most important. Then we look at the meal timing and distribution. And again, for someone that's trying to preserve muscle, what research has suggested is eating similarly balanced in protein total each meal. So for example, 20 to 40 grams at breakfast, 20 to 40 grams at lunch, 20 to 40 grams at dinner, and then having some snacks in between there has really been helpful for muscle protein synthesis, meaning building, and to really stimulate and maintain that muscle that you have. So that 20 grams is really kind of that threshold that we have seen is necessary for us to get into that muscle protein synthesis, pathway, so to speak.
And I'm thinking about what you just said in terms of sarcopenia for aging. You really do the same thing with protein timing, is that you really would like to get 20 to 25 grams 3 times a day, if possible, spread out in 3 different timing periods for this same reasons. I think that that's a great idea for you to share, because that's really important in terms of how the body's going to use it.
Absolutely.
So let's look at tying in something people wouldn't think about. How important is staying hydrated? And then how do you tie that in with what you eat?
Yeah. Well, because especially on these medications, again, our appetite is really suppressed, and that can also result in less fluid intake too. So I really encourage folks, hey, keep your fluid bottles nearby, because again, if we're really prioritizing protein at each meal and we're so limited already in what we're taking in, we may not be eating adequate fiber, for example, to pair with that protein. And that can lead to some issues like constipation.
Yeah.
And then as another, some side effects we can see from these medications can sometimes be diarrhea. And so you can see both sides of the spectrum, so to speak. So fluid intake is important for both. And so I just encourage folks, hey, keep fluid bottle nearby you. You should be sipping in between your meals. We're sipping as frequently as you can tolerate, just to keep that fluid status, adequate.
This question, comment, and then I'm going to turn it into a question, is coming up a lot when you're hearing people that are using the GLP-1s with or after bariatric surgery are saying, you know what, I'm just not hungry. My appetite is just not there. So opposite, they're not eating enough calories. And I know you're thinking, really? I want this problem. I want this problem. I've had the opposite my whole life. It would be a great thing if I'm not hungry anymore. Yes, it is a great thing, but sometimes this is a side effect from the medication where your appetite is so reduced that you don't want to eat or eat at all. And this can have its own set of nutritional issues. So Kim, talk about that.
Yeah. I mean, first off, I would say if you really get to a place where you have zero appetite, you want to speak maybe to the prescribing doctor. Perhaps the medication dosage can be adjusted. You might need to step back down to the previous dose, because again, these doses do generally increase over time as you take them. So you got to get to that dose that you feel like you still have somewhat of an appetite and can take in adequate amount of nutrition and achieve the goals that you're aiming for. So I would say, again, with that, for some folks, I would say do your very best. If it's more eating just smaller, more frequent times, if you can tolerate it, I would, do your best to try to incorporate something maybe every few hours, just so that you're getting in some nutrition. Even if your body's like, I'm not necessarily hungry at all, you still need nutrition.
Yeah,
you don't want to have, you don't want to have deficiencies. You don't want to be losing muscle, at an increased rate. So it's important to still take in nutrition to prevent those things from happening. So I always recommend you might want to speak to your doctor about that medication dosage.
I agree with that also, that it can be too high and then you totally just aren't eating, and then your labs are going to be off and you're going to have nutritional issues, and you don't want that. Plus, you've got to get that protein in to protect this muscle or to rebuild it. So I'm sure that you're still saying, and when you do eat, you want protein to be the first choice.
Absolutely. So prioritizing protein at each meal first is number one. And then we go, around the plate and we get our fruits and our vegetables and our whole grains, heart healthy fats, etc. But definitely that's why, again, we go back to the fluid discussion. If you are prioritizing protein, that in and of itself can be constipating. So we want to make sure we're sipping on our fluids then in between meals throughout the day.
I was going to ask that. So you like the 30-30 rule?
I do.
Or similar to that in terms of meaning of having your fluids separate from when you're eating your food.
Yes. So put space in there for you to take in that food that you need to get in.
I totally agree with that. But sometimes you may feel nauseous or, like you said, have diarrhea and you just don't want to eat. So sometimes you may feel too full. Other times you just might not feel well. What are you doing in this situation, Kim? How do you deal with that?
I mean, I've had some folks that just did well with, maybe incorporating a protein shake just to get in some fluids that have protein in there. I've had some folks that incorporated some soups they were able to tolerate. They added some whey protein powder in there just to get a little boost of protein. Whatever it is for you that we can just try to get something in. Obviously, for some folks, meats might be too heavy. So we might just need to go back a little bit to some softer, easier tolerated foods that we can get something in. It's better than nothing.
And don't you think, too, the same as what you were talking about with appetite a few minutes ago, if you have diarrhea that continues, if you're not able to eat, you don't have an appetite, or you feel nauseated, you need to circle back and have a discussion with the prescriber on this. That's why when you get these medications, it's really important that you have a good discussion before to make sure if they're right for you, which drug is right for you, and then which dosage, so that you have less of these problems. Don't you think?
I agree with you 100%. Yep.
So I'm thinking about, as we just talked about, the potential for nutrition issues, about how important the consistent use of bariatric supplement is, especially if you're doing GLP-1s after bariatric surgery. What's your feeling on that? And do you have a structure for that? Do you have a certain plan? What do you do when it comes to the supplements?
Yeah. So are you talking about bariatric vitamins and minerals
Yes,
or more?
absolutely. Yeah.
So absolutely. I mean, as if we don't hone in on it already after bariatric surgery, especially now with the GLP-1s, we're kind of going back to, I kind of use the analogy of you're almost going back to like when you just had your surgery, right? We're going back to that really kind of low intake state. And so your overall intake from your food of vitamins and minerals are already going to be reduced and now further again. So absolutely, they should be taking their daily bariatric multivitamin, their calcium, whatever their surgical center has recommended, and also lab work. As a bariatric individual, annual labs absolutely for the rest of your life are required. And these vitamins and minerals never go away. They are required for life. And then when you layer on the GLP-1s, which again are suppressing our overall intake, it is critical that we are getting in these, vitamins and minerals then from a supplement. So I am a huge proponent.
You may have to tweak those. You may have to tweak what you take based on the med that you're taking and how that's affecting your body. So this is why it's so important, that relationship with a bariatric dietitian, with a team, with a prescriber that's put you on the medication. Well, I want to get into what you're really good at too, and that is getting specific about exercise when it comes to preserving and building muscle mass. Talk about the type of exercise, the frequency, and I'm especially thinking about resistance training and why that is so important when you're taking these obesity meds.
Yeah. Resistance training is so key. When we are trying to preserve and or build muscle, resistance training is necessary to stimulate that growth. That paired with adequate protein intake are the two things that are going to help drive our muscle, over time. So when you're taking medications such as these and I want to highlight, we don't really know what the mechanism is that might be resulting in the muscle mass when you're on these medications. They're still trying to sort that out. Is there actually a mechanism from these medications that are targeting muscle or not? Or is the muscle loss just a result of overall body weight loss from being in a low caloric environment? So they're trying to rule that out. I think now they're, looking at that specifically. But when we talk about resistance training, it's important and helpful because, for example, resistance training in and of itself stimulates muscle protein synthesis for up to 24 to 48 hours after a training session. In addition,
I love that. I mean, that's significant, right?
It really is, because now when you are taking in protein at meals, that is helping us to build muscle, right?
Yes. Yeah.
In addition, what's cool, I think, with resistance training is it also increases muscle sensitivity to amino acid uptake. What does that mean? It means kind of the doors are open and are ready to take in amino acids that we are eating from protein foods in our diet. So our body becomes even more sensitive when we do resistance training to taking in those amino acids to help us build muscle. So in terms of how much in a week or whatever, in general, a minimum amount would be about 2 times a week of full body resistance training, up to maybe about 4 times a week, just depending upon your preference, your time availability, those types of things. And the other key is what's called progressive overload. And that means over time, you are basically increasing the weight, or are you increasing sets or repetitions, or decreasing your time of rest in between sets. There's lots of variables that you can adjust that can help keep you moving in a positive direction of gaining muscle.
So I want to take just one step back here for those who are saying, I've never done weight training. I've never done resistance training. What exactly is resistance training? And if I've never done this in my life, how can I start this simply without feeling overwhelmed?
Yeah, I'll answer that first. There's lots of, very well educated folks out there that can help you to develop a resistance training plan. And that's just lifting weights, right? It can be dumbbells. It can be with bands. It can be, of course, with machines, etc. So it's basically just you pushing against resistance, right? So pushing, pulling, different movements. And there's lots of, folks out there that are trained in helping you to develop a plan. So if you've never even done it before, you're not going to go in and lift heavy weights. They're going to start with where you're at and increase you over time in a gradual way to keep you safe and to see those results over time, which is generally increasing some lean muscle mass.
And one of the things I love that we haven't mentioned, this doesn't have to do with muscle mass, but it's just a side benefit. And that is the way it makes you feel.
Yes.
the mental boost of resistance training that goes along with it, that to me pairs with that muscle mass protection and building, don't you think?
Oh, I can't agree with you more. I mean, sometimes it's just hey, I don't really want to do this, but when you go and you feel your body, honestly, I like feeling tired afterwards. I'm like, man, I know that I really challenged myself today. Yeah. And then also just week by week, you're seeing the weight that you're lifting going up. And that's exciting because you're increasing your strength. And I'll highlight this. Oftentimes we are going to see strength gains before we're going to see muscle mass gains, because muscle mass gains takes energy. It takes protein. And that's hard when you're in a caloric deficit, especially after bariatric surgery or on GLP-1s. So seeing strength gains is great because that means you're improving your quality of life, your mobility, your flexibility. And as we all get, older and move in forward in life, we do have that risk of losing muscle mass each decade.
Absolutely.
So resistance training is going to help to mitigate that and reduce that.
I agree. Totally. Well, as we wrap up and I'm thinking about all the good information that you've shared, what do you specifically want to leave us with today?
Yeah. I would say when you are taking these medications, adequate protein intake and resistance training are two of the most powerful interventions that you can incorporate that will help you to preserve the muscle that you have and target more of that body fat loss as you're going through that rapid weight loss phase. And just whatever you can tolerate, start with where you are and make gradual changes. If your appetite's low, take in what you can take in, but do it in a way that is comfortable for you, but do try to keep that focus on the protein and then try to incorporate some resistance training as well.
Great information, Kim. Thanks. And realistic. And I think that's where we have to be. You have to be realistic and start where you are and work forward. Thank you for sharing your valuable time with us today.
I am so glad to be here. Thank you for having me.
So here's what I want you to do this week. Think about what you just heard from Kim. Where are you right now? Are you eating enough calories? Is your protein timing correct? Are you eating enough protein-rich foods? Where does resistance training fit in? This is also important. Why? Because you are worth it.
Bariatric Surgery Success with dietitian Dr. Susan Mitchell is produced and owned by Practicalories, LLC. All rights reserved. Remember, the content provided on this podcast is for information purposes only and doesn't create a patient-provider relationship. It's intended to provide reference material and is not designed to provide medical advice. Please consult your healthcare provider regarding any medical issues you have relating to symptoms, conditions, diseases, diagnosis, treatments, and side effects. Podcast guests express their own opinions, experience, and conclusions which do not necessarily reflect or agree with the host, Dr. Susan Mitchell or Practicalories, LLC.